day of surgery, they come in, they meet our anesthesia colleagues, they get a special injection in their back and a catheter in their arm. The injection in the back is to cause some freezing for pain control. And then once under anesthesia, it's a small incision on the side. And through that small incision, we go through the ribs. We don't break any bones or anything like that. And then expose the heart, put the patient on the heart-lung machine, stop the heart, go inside the heart, and then place very special lines that really is the description of the Cox-maze procedure. It starts into the left atrium, and the first step is a epicardial or on the surface ablation using the freezing wand. The second is ablation lines on the inside of the left atrium, what's called the floor lesion, the roof lesion, and the mitral line. Those are all usually for 3 minutes. Then we go to the right side of the heart, the right atrium, and do lesions to complete towards the tricuspid valve, a lesion along what's called the superior vena cava, or the upper vein of the heart, the right atrial appendage, and the inferior vena cava, which is in the lower vein of the heart. Once that is done, the ablation portion is complete, and then, and most importantly, we completely obliterate the left atrial appendage. Now that is done with a very precise technique that we've worked on here and proven time and time again, that it completely obliterates the left atrial appendage in a very safe and homogeneous, smooth way. Why is that very important? Well, many of these patients are often on oral anticoagulants because of the risk of stroke in atrial fibrillation. Well, in our experience through this technique, we've been able to successfully send people home without anticoagulation, oftentimes for the first time in many months or years. And we have shown longitudinally or through follow-up that the risk of stroke is essentially similar to the normal population. And so it's a way to not only cure the atrial fibrillation, but also reduce the burden and reliance on certain medications.